Hello, everyone. I was just going to share a tool that I've been working on for very recently, so it hasn't been shown at October before. We call it the classroom ventilation calculation tool. And basically, what we're trying to do is why should we care about ventilation? Well, we're in a pandemic, and when that happens, this is why we have aerosols and droplets being expelled. Hopefully, we put on some kind of a mask, but most of the masks that people are wearing will probably contain some of the green stuff, but not the red stuff. So it'll get into the air. And once it gets into the air, the thermal convection currents and the air currents in the room will carry it around, and other people will also be exposed. And we already knew that indoor air quality in classrooms was important. We've seen studies that show that low ventilation rates affect cognitive function in schools and performance in classrooms. And this has been known for quite a while. Also, recently, there was studies that looked at a comparison of using masks and ventilation to reduce COVID incidents in elementary schools. And what they found that masks alone was about a 37% reduction in infections, whereas ventilation was about the same. However, if you added filtration, it went up another 10 percentage points. So you kind of wonder, why are we policing masking so severely, but not ventilation? Since ventilation probably has the bigger impact. I think a lot of you who have been looking at ventilation in schools have noticed the Joseph Allen criteria. It's been spread quite far and wide. Also, he has a prioritization where he suggests that increasing ventilation rate is the number one way to improve the air quality. Increasing filter efficiency is number two, and supplementing with portable air cleaners is number three. And we've seen even ASHRAE trying to turn this upside down in order to save money for energy. But this was the priority originally when this plan was put out. This criteria is also being used by a lot of the consultants in Ontario anyway when they evaluate school ventilation. So it's all about air changes per hour. So let's look at what air changes per hour is. Well, first you take the length and the width and you multiply the two and you get the square footage of the classroom. And if we also take into the height, we can figure out what the volume in the room is. And if we have a certain amount of air coming into the room, we can actually calculate what the air changes per hour are by converting the cubic feet per minute to cubic feet per hour. So 725 is just over 43,000 cubic feet in an hour in a room that's just over 7,000 cubic feet. And that works out to 6 air changes per hour. And that's assuming you're getting good mixing. And in a classroom, especially if kids are walking around, mixing is pretty good. Now, if the air coming in has 80% recirculated and only 20% outdoor air, then the amount of outdoor air is not 6 air changes per hour. The outdoor air exchanges is 1.2 or 20% of 6. 1.2 air changes per hour of outdoor air. And when we look at some of the criteria, the goal for classrooms, according to a European version of ASHRAE, is at least 5.3 air changes per hour. What we just calculated is equivalent to 1.2 air changes per hour and is not that great when it looks at the relative risk of infection. So here we have a spreadsheet, and the first section is about the ventilation system, what type it is, the dimensions in the room, and the room occupancy. So this is the easy part. You can use a tape measure or count ceiling or floor tiles. There's even apps on cell phones that let you measure distances. You can check out the building layout or the plans or even the fire exit layout posting if it has a scale drawing. You don't need to be exact. The nearest foot will do. And the area and room volumes are calculated automatically, so you don't have to do that math. And you can enter both the typical and the maximum room occupancy, and you can pick which one you want to use to do the calculations. So I thought I would apply it to our new office in Hamilton. And in the office, we have a training room, which is, kind of a classroom. So we have the size here on it, and we also have the occupancy. So the size is about 22 feet by 15 by 9, and the occupancy is about anywhere from 10 to 20 occupants. And so when we populate this, it calculates that the square footage of the room is 322, which is pretty small for a classroom. A typical classroom in a school is about anywhere from 675 to 1,000. And the volume is calculated and the room capacity. The spreadsheet also calculates 6-foot diameter circles around each occupant, and you can see whether or not 6-foot distancing is achievable. And if you select the maximum, 20 people, there's no way you can achieve 6-foot distancing in this room. So there's kind of a warning in the spreadsheet for that. So if we reduce the number of people in the room and we select typical instead of the maximum and we use 6, then only when we go down to 6 can we achieve the 6-foot distancing. And next section is the room ventilation rate. Now, this gets a bit tougher. You probably have to ask somebody about this information, somebody in maintenance or facilities. Sometimes joint health and safety reps also know this information. And it's usually found on the building drawings or the ventilation plans. And this would be the design flow rate, and it's measured in cubic feet per minute. However, if you have a ventilation balancing report, you can also use that. And that would be in the measured flow rate. And the spreadsheet prefers the measured flow rate over the design flow rate, so it will all automatically select that one. And also figuring out what proportion of outdoor air supply, it can also be difficult, so you need to ask someone. Some ventilation systems have a fixed system where it's mechanically locked in. Others are variable, and so you might need to know the maximum or the minimum and take the average or either the lower rate and enter that into proportion of outdoor air supply in percent. And then it will calculate the total air turnovers and also how much of that air turnover is fresh air, so outdoor air changes. So for our building, we actually did have a balancing test that was done this past July. So at the appendix of the report was this drawing, and there are 2 ventilation systems, and this is the one that we were interested in. And since we're interested in this room that's called storage room, in July it looked like a storage room because it was chock full of junk instead of a training room and what it was supposed to be. And so from the report, we can figure out how many CFM are coming into the room by adding 7, 8, and 9. And here's the report, and here are the CFM. And here are the 3 numbers that go into this storage/training room. So we get 574 CFM coming into there. We also know the total CFM of the whole system, and there are 2 systems. So system 1 has just over 2,000 CFM. It also shows the adjustable setting for the outdoor air supply, and it's set at 30%. And the way you get that is you count all the stripes, and you notice that the X is the third stripe out of 10. Now we also have from the balancing report some measurements of how much outdoor air is coming into the building. And here it's 1169 CFM coming in. And when you combine the two systems together, you get 3800 CFM. And if you divide 1169 CFM by the total, you get about 31% outdoor air coming into this building. So that's a little more detailed way of doing it. But once we enter those numbers in, and if we have a room capacity of 6, we've got lots of air. And it also, the spreadsheet also evaluates whether or not you're meeting ASHRAE 62.1 standard. And so here we have the measured or flow rate from the balance report and the 31%. And we have almost 12 air turnovers per hour and 3.6 air changes per hour of outdoor air. Now, if we change that back to 10, we'll notice that the distancing is no longer achievable. However, we still are meeting ASHRAE standards. Mind you, these are ASHRAE standards pre-pandemic. During the pandemic, ASHRAE has upped the amount of air buildings should take in to 6 to 12 air changes. And so we've only got 3.6 air changes, so we're not meeting the 6 to 12 yet. If we look at the maximum capacity, we can't distance and we can't even achieve the ASHRAE standards, and we're not doing too good. So one of our fellow hygienists in the clinic, Masood Ahmed, actually went in and he measured what it was. So here on the drawings, we have 210, 200, and 170 CFM coming into this room through 10 by 4 registers. And when he measured it, he got 832 CFM versus 574 that they had. And we know the drawings, for some reason, say 2,000 CFM of outdoor air is coming in, but from the balance report, the measured amount was 1169. So, and this is not uncommon. I've seen in many balancing reports that you can be half or even double of what the design flow rate is. So it's quite variable. So when we add these numbers into it, here we have Masood's measured flow rate, 832. And so the program takes this number instead of the 574 because it's measured. And then you see we're approaching the 6. We're at 5.3 air changes per hour. We're still below the ASHRAE standard, though. And only when we go up to 35% outdoor air do we start meeting the ASHRAE standard. And then we have 6 air changes per hour, and then we're finally at our target. So that is the existing ventilation system in our office. However, the landlord contracted a ventilation engineer to replace the ventilation system. And he wanted to replace the two systems with 2,600 CFM and an airflow of 500. And so this is about 68% of the airflow that we have right now. So it's going to go down. And also we currently have 31% outdoor air, and that's going to drop to 19%. So what will that do to our system here? So if we put in the 3,900 CFM, which is 68% of what we currently have, and we change the outdoor air proportion from 31 to 19, you see that we're way below the ASHRAE standard for the amount of outdoor air per person. And even if we take 30 or 68% of what Masood measured. We're still well below, and we only have 2.2 equivalent air changes per hour. Okay, now let's add filters. Well, filters, if the standard filter in most places is a MERV 8 filter prior to the pandemic. And so finding out what kind of filters you have should be fairly straightforward. You could probably ask someone for this information, maintenance, facilities, again, a health and safety rep, or even a purchasing agent. They may know. They may not give you the MERV rating. There are other ways of classifying filters, and I have a slide that kind of converts the different ways of rating filters coming up. If you feel adventurous, you should actually go and have a look inside the unit. And it's good to have a look because you can have the best filters in the world, but if they're not sitting snugly and they're not fitting well, they won't do what they're supposed to do. And if you're in there and got the system open, take some pictures because it's always a picture is worth 1,000 words. And here, again, the MERV rating cleans out some of the particulate in the air, not much, and it's equivalent to almost 2 clean air changes per hour. We also have a little thing here where people can put in the date when it was last changed, and we didn't know when it was. And even putting that in is just a red flag when somebody reads this that, hey, we should go check when it was last done. And or better yet, have a look at the filters and see if they need changing. And here's what I mean by a picture is worth 1,000 words. Here you see on the left-hand side, there's a filter that's been bent, so the air is actually passing around it. You also see other problems. You see evidence of moisture and dirt, and perhaps even mold growing in some of these things. And taking a picture will make a better argument than saying this in words. Here's the slide that compares the different ratings. You have the MERV rating on top, and then you have the MPR rating, and then you have the FPR rating below. And there's also a TO rating in there. And MERV 11, MERV 8. MERV 8 is what we normally had prior to the pandemic. MERV 11 or MERV 13 is what most places are going to now. And here are the filtering efficiencies of these different filters. And I thought I would show what the masks can do. So a gator mask is equivalent to a MERV filter of about 1 to 4. A cloth mask is 5 to 6. MERV 8, this is what we had prior to the pandemic, is equivalent to a surgical mask. An N95 respirator is anywhere from a MERV 13 to 15. And an N99 respirator is equivalent to what we would call a HEPA filter, or high efficiency particulate absorbing filter. Now, if you have an N95 that has an exhalation valve, when you're inhaling, you're about MERV 13 to 15, but when you're exhaling, you're the same as a surgical procedural mask. And by the way, a surgical procedural mask is about the equivalent of putting your hand over your mouth. It's about the equivalent filtering efficiency. And by the way, last Friday, the Public Health Agency of Canada changed their advice on community masking, and they suggested that you are now allowed to use a respirator, and you don't need to have formal fit testing to wear it into community. I think some teachers might be glad to hear that and let their school boards know about it. Okay, back to the classroom. So we have 20% outdoor air coming in with 725 CFM. And now what we want to do is put in a MERV 8 filter and see what that does. And 20% of the air is about 116 CFM of filtered air, which is equivalent to 1 air change per hour. So we add that to the 1.2 and we get 2.2 air changes per hour. And so we're a little bit better, but not much than we were before. Now, if we take the same thing and we put a MERV 13 instead, we actually get the equivalent of 4.3 air changes per hour, which added with 1.2 will give you 5.5 air changes per hour. And now we're getting somewhere. So the next section is, well, if we put in this MERV 13 filter, then we have 8.5 equivalent air changes per hour in the room that we have in our office. So 8.5 along with the 2.2 with the proposed changes based on Masood's measured, 68% of Masood's measured flow rates gives us just over 10.7 air changes per hour. Now the next section is the portable filters. What if we add a portable filter to this? Well, this gets a bit complicated and it's really consumer beware. You can find the Catter numbers, although they're not always given, but if it's a HEPA filter, then the CFM would be appropriate. But be careful, some manufacturers actually give their flow rates without the filter, and you have to read the fine print to find out the airflow with the filter. There are different speeds, which mean there are different flow rates and different noise levels. And the noise level is important because, especially in a classroom, if you have to turn it down to the lowest setting and you're buying it thinking you're going to operate it at the top setting, you'll be in for a surprise. And don't go for all the extras, the ion generators, the UV. I even saw one with which emitted vitamin C into the environment. So here's the one that was bought for our office, the Blue Pure 211. And in the specifications on the website, you can read the clean air delivery rate. It's 350 CFM for pollen, dust, and smoke. Generally, we use smoke as the it also gives the sound level, and it ranges from 31 to 56 dB. There are 3 settings on this thing, so we know what the low setting is and we know what the high setting is, but we don't know what the middle setting is. Now, you can also go to a website called Verifide, which is independent testing agency for air cleaners, and they give a certificate for whatever product you pick, and it gives you only the CADR numbers, nothing else, nothing about noise or anything like that. So I didn't find it that useful, and it also seems to be kind of a way of selling these things. There's also Energy Star. It has a website where you can look up air purifiers and you get a lot more detailed information. You get the CADR numbers, which aren't rounded off this time, so you get more exact numbers. But it doesn't have noise. Then if you go on Amazon, you can find the user's manual, and the user's manual is probably where you get the most information. And here it gives you the CADR numbers, it gives you the noise level, but it also gives you the airflow rate, which is handy. And so we can populate this part of the spreadsheet. We have 350 CDR at top level speed, but it was 56 decibels. At 130 CADR at low speed, we have 31 decibels. And if we have one unit and we select the maximum, we'll have 7.2 equivalent air changes per hour just based on the air filter, but the background noise will greatly exceed the ASHRAE recommendations. The ASHRAE recommendations are 30 to 40 decibels for a classroom. We put a middle zone from about 40 to 50 or 55 decibels as tolerable but still noisy, and then over 55 as intolerable. So if we change this to select the minimum, so we were only getting 130 CFM, Catter. And however, the background noise meets ASHRAE, but now we're only getting 2.7 equivalent air changes per hour, whereas we had 7 point something or other beforehand. So winding up, the last element in it is supplementary fans. So if you put a fan in the window and you run it about 10% of the time and it has a 250 CFM flow rate, you get another half. It shouldn't be equivalent. This is clean air coming in. And basically, looking at this table, you can see that we've evaluated the distancing, whether it's achievable. We've calculated the outdoor air exchange rate based on the ventilation. We also evaluated whether or not we met ASHRAE 62.1. We've measured what effect the filters have on, plus we've also commented on when the filters have been changed or not. We've looked at the noise that the portable air filters put in and how much equivalent air changes per hour the supplementary portable air filter provides, this case at the lowest speed because we wanted to keep the noise low, and how much putting a fan in the window will. And when you put it all together, you add it, you get 14 air changes per hour, and the target is at least over 6 to 12. And if you have a carbon dioxide meter, you can also put that in there, and it changes color depending on what number you put in based on this, and you're supposed to put the peak carbon dioxide concentration in there. And then once you have this, you can post it on your door, and so everyone who enters the room knows exactly what they're getting into. And so that's the tool, and thanks. And any comments or questions, I'd be glad to entertain them.
Thanks, John. There are a few in the chat window, some good comments. I don't know if Val's able to unmute, but about whether the Delta variant, and Kevin's commenting also from the network, looking at, should the air change per hour level recommended, be altered for the Delta risk?
Well, the Delta risk is much higher. I saw a recent contact tracing report from South Korea that showed that people were getting infected in much less than the 15-minute 6-foot unprotected zone that was being used originally. These people were being infected with as little as 2 minutes exposure, and they were both masked. Also, people were being infected when they entered a room 40 minutes after the infected person had been in there. So yes, I would agree. No one has changed any of their recommendations based on this. So, if ASHRAE says 6 to 12, obviously, if it's Delta, you probably want to be at the higher end, not the lower end. But yeah, it's quite amazing that no one is adjusting their recommendations and their criteria for the Delta variant.
And on that note, there's another question from Richard Visser about increasing the MERV rating. So when you increase the MERV rating on a filter, would that decrease the airflow rate?
Yeah, I just saw a recent presentation where there's a guy named Rosenthal who's creator of the Corsi Rosenthal filter, where you take a box fan and tape a number of filters to it. And in his presentation, he actually said that the pressure drop for a MERV 8 filter is about 0.2 inches of water. And for a MERV 13, it's about 0.26. So yes, there is an increased pressure drop, which stands to reason. However, in his opinion, and he's much more of an expert than I am. He thought that that was not something that most systems couldn't overcome. So I don't think it's too big a deal. If you use MERV 11, if you try the spreadsheet out, you'll see that MERV 11 will often do a pretty good job too, if you're worried about the pressure drop on your HVAC system.
Thanks. And feel free to unmute your mic if there are additional questions that aren't in the chat. And John, I did just want to also point out that the tool is quite user friendly. I know that sometimes we seem more technical, but a lot of the presentation, John, focused on where you could get this information simply from, fire drawings, and it isn't quite as complicated as maybe it looked in the example I wanted to mention. So, don't be shy to give it a shot, and you can see it now on our website. And sorry, Val had put a link in and I didn't see it because my chat window was shorter, and I did myself as well. So they're both there. Oh, Val, do you want to unmute, or do you want me to read for you? You might not be able to. So Kim,
I'm just changing my granddaughter to go. And we're going to see her new house. So no, I'll just let you read it. Thanks.
Thanks. So Kim, Val mentions that Kim Prather recommended particle counters and CO2 monitors for each class in San Diego. Do you have any comments about that, John?
Yes, the Riva, the European version of ASHRAE, also recommends CO2 monitors for each classroom. And in Quebec, they bought CO2 monitors for each classroom in the province. However, in Quebec, they won't necessarily allow people to see the numbers, and they don't have a criteria of which to judge it. So CO2 is a good way of evaluating whether or not you're achieving the ASHRAE guidelines for outdoor air supply. And the Harvard people are recommending 800, keeping it below 800 parts per million. I use the standard, which is at the bottom of the sheet, which comes from the Ministry of Labor, actually, from the late 80s, early 90s, which they produced in order to solve indoor air quality problems. And so you can put it in there. If you're going to use particle counters, again, the problem is what standard are you going to use? Are you going to determine? Plus, particle counters sometimes outdoor air can introduce particles from outside, and it fluctuates more than the carbon dioxide does from outside. What particle counters and CO2 monitors can do, however, is if you data log it and track the decay after people leave the room, then you can calculate actually from the decay curve the air changes per hour. And so they can be used for that, but it's a bit of a technical calculation. If anybody has such data, give us a call and we can show you how to do the calculations. But you need to run it for, let's say, at least, let's say, a 24-hour period so that you have the decay curve overnight. And from that, you can calculate the air changes per hour.
Yeah, thank you. And of course, we're using surrogates for traditional indoor air quality monitoring in general, and applying them to COVID. So this is all of these ideas can be used in conjunction. I see Kevin's hand. Go ahead, Kevin.
Yeah, I guess we're learning a lot as we're going along, and I know that a lot of our colleagues, the people that are kind of promoting CO2 monitors are actually using this particular kind of monitor here. I'm not getting any commission for this, by the way. I just thought I'd share this with you. It's an Aeronet 4 and I'm told that the batteries actually last for 4 years, so I just leave it on all the time. And even the president of the AOH, Kate Cole, she carries this around in her handbag, and when she goes shopping, she kind of looks at it. I've used it when I've traveled in airports, but the good thing is I've just holding my phone up at the moment, my iPhone. I've got it synced to my iPhone, so you can sort of, it data logs. And just to go on what John was saying, I did share the data file provided from this with John from my bedroom overnight, and he kind of did a quick decay curve, and he said your air changes per hour in your bedroom aren't very good, Kevin. So I just thought I'd share that, and it's a handy unit to have with you as well. Thanks.
And your number today is over 800 too. Open your windows.
It was a noisy across the room, and there's only me in the room, so I don't think I'm going to infect myself. But anyway, point taken.
Actually, buildings are quite porous, and air moves along conduits through walls and things like that. Even a house with all the doors and windows closed has an air change rate of somewhere between 0.1 and 0.4 air changes per hour. So just closing the door and the windows doesn't seal you off from whatever else is in the building.
Thanks, John. There is another question about asking if the tools based on the updated ASHRAE standard 2019, there were significant changes to the calculations for mechanical and natural ventilation.
It's based on the classroom equation from the 2019 ASHRAE standard.
Great. Yeah, she wasn't sure. She may have missed that.
No, I didn't mention that. No,
okay,
that's fine.
perfect. Excellent. Thank you. Any other questions for John? This week we have Health Canada returning to our October session, this time to talk a little bit about what they've done around the chemical management plan. Kevin alluded to some work that we'd done with them on the chemical management plan around banding and comparing with government assessments. So that will come later, information on that, but they're coming to join us to talk about some occupational exposures of Ottawa firefighters to toxicants of concern and some work they're doing on that. Nancy's going to join me to talk a little bit more. You got a sneak peek today about the evolution into the occupational illness prevention plan from ODAP, and then Eduardo will join us rescheduled from today with understanding and responding to the COVID-19 information needs for international agricultural workers in Ontario. So really hoping everybody can join us for our last session next week. So without any delay, I'll give you back a few minutes to your Friday afternoon that you may all be begging for, and hopefully catch you next week. And take care, everyone.